हेलो फ्रेंड्स, आज हमारा टॉपिक है कोष्टास दैट इज थेरापेटिक टेस्ट फॉर डायग्नोसिस ऑफ bowels that is purisha. That is shloka is there, big shloka is there, but some terms are remembered. That is मृदु कोष्ठ स्त्री रात्रेण स्नीयात्य चोपसेवया स्नीयति क्रूरकोष्ठस्तु सप्तरात्रेण मानवः गुडमिक्षुरसं मस्तु क्षीरमुल्लोडितं दधि पायसं कृशरां सर्पी कार्षमत्रिफलारसं द्राक्षारसं पीलुरसं जलमुष्णम् अथापि च मध्यं वा तरुणं पीत्वा मृदुकोष्ठो विरिच्यते मीन्स. एंड नेक्स्ट इज विरेचयन्ति नैतानि क्रूरकोष्ठं कदाचन भवति क्रूरकोष्ठस्य गृहण्यतुल्बनालिला उदीर्णपित्ता कफाः ग्रहणी मंदमारुता मृदुकोष्ठस्य तस्मात् स सुविरेचो नरः स्मृतः. दैट इज आचार्य चरक सूत्रस्थान 13 chapter 65 shloka. Shloka decoding is: the person with laxed bowel is properly oleated by taking unctuous substances for 3 consecutive nights, one with causative bowels for 7 consecutive nights with following drugs such as means the person with laxed bowel movement and properly oleated by taking unctuous substances, that is sticky substances, this consecutive nights, one with causative bowels for 7 consecutive nights. Following drugs such as the laxative bowel movement is there na, so we can give to unctuous substances, that is sugar candy, sugar cane juice, mastu, milk means payas, cream, next from the curd payas, gruel made from taila, rice masha, ghee, juice, kashmard, haritaki, amlaki, bibitaki, draksha, pilu, even hot water, fresh wine. Intake of any of this serve as purgative of this mrudukoshta because their grahani, that is duodenum, including small intestine, is too much dominated by pitta. Next, purgation is easy for those with laxed bowel because their grahani is dominated by pitta dosha. And lastly, affected by kapha and vata. Purgation is difficult in case of vata in grahani. In case of lax bowel, grahani is predominated by pitta with little quantity of vata and kapha. What is the therapeutic test? What is the therapeutic test? We give some food products to the patient and assess the bowel movements of the patient, and then can assess the which type of koshta is there: vata koshta, pitta koshta, kapha koshta. That is. Next is clinical significance of the koshta. What is the clinical significance of koshta? Koshta is the examination of koshta is very necessary for the following. That is, since 5 cleansing procedure are inevitable in case of vitiation of. Next point is there doshas, vitiation of doshas, that is snehapana and svedana are investigable and preoperative procedures before performing the cleansing ones. In our panchakarma there are preoperative procedure, that is the purva karma, that is the snehana and svedana. Next, this reveals predominance of dosha and makes the physician to judge the line of treatment and can advise what to do, not to do, that is advice. Appropriate line of diet can be decided as diet supposed to be one of the lines of treatment. For snehana, what is the snehana? That is oleation therapy, which unctuous material should be used as decided. Dose and drug of choice imitates purgative can be decided. Vata is there, then give basti. Pitta is there, then give virechana, that is the purgative drugs. Kapha is there, that is the vamana, that is gives the vomited types of drugs. What is possible questions in Koshtas? First about what is Koshtha, and next explain different types of Koshtas. Next explain Mridu Koshtas, explain Madhyama Koshtas, next explain Krura Koshtas, next explain therapeutic text or diagnosis of Koshtas, next explain clinical significance of Koshtha. Thank you.